Welcome to A Call to Action, presented by Great Eastern Radio and Brattleboro Community Television. We're covering many different topics from retooling your company to safeguarding your Zoom meetings. Today, we're talking with Laura Overton. She is the director with the local Brattleboro Health Office. I'm Peter Fish Case. Laura, welcome to A Call to Action.
Thank you.
All right. Let's get into it now. So outside of a pandemic, what exactly does your office do? What do you do?
Sure. So we are, the local health office is a division. So local health is a division of the Vermont Department of Health. So we here, our staff of 11 are really responsible for implementing a lot of statewide programs at the local level. And so some examples of that are, we have a WIC clinic here. So that's the Women, Infants, and Children Clinic. That's a federal program, which is a supplemental nutrition program for pregnant and breastfeeding moms and their kids up to 5. So we have that clinic in our office, and we serve the Brattleboro Agency of Human Services District, which is most of Windham County, but not quite all of it. We have public health nurses on staff who do immunizations for under and uninsured folks. We have staff here who work with all of the school districts on health planning and program planning. We have staff who work on chronic disease work, which would be an example of that is working with the Brattleboro Coalition on, it's like an active transportation coalition. So we'll help them with thinking about how to implement bike lanes or making a more walkable community, to name a few. And then we also have a staff member here who we're very lucky to have right now. She is our emergency preparedness coordinator. And so her job is really to make sure that we have agreements with a lot of different hospitals and settings to do, if there is an emergency, we can all work together to figure out how to best prepare for it.
Okay, and I assume that all those services are still in place, even though the focus is on a little something called COVID-19.
Yeah, so we've actually back in March now, we have kind of removed a lot of, we're still we're providing services for anyone who we normally do, but we are kind of in pandemic mode. So that means anything that is not federally or state necessary for us to do, we've redeployed some of our staff to help with COVID response. So we still are operating a WIC clinic, but no one comes to the office for their appointments anymore. It's all done on the phone. And some of our folks who work, for example, on chronic disease prevention or substance use prevention, their work is still happening at a much lower level because they've been redeployed into helping with, for example, contact tracing or testing sites.
Okay. So there is a little contact tracing going on here in Windham County.
There is, and so I can explain that a little bit. The state had a pretty big backlog for a while. I think had, I don't know, maybe 500 to 600 folks who we hadn't reached out to do contact tracing, because I think we were still pretty much in the middle of figuring out how to do that. So it was pulled from the local level and kind of centralized, but our staff would end up doing contact tracing for folks maybe in a different county or a different district. And that work is now coming back to the local level. So if you test positive, and you're in Windham County or in our AHS districts, then you can probably expect a call from somebody from our office to do the contact tracing. And that wasn't necessarily the case a few weeks ago.
Okay. Now, is that, there was, I think in New York, of course, which, quickly turned into ground zero for this whole pandemic. I think they were looking for volunteers to help with contact tracing. Are we at that level right now, or have you guys got it pretty well handled?
To my knowledge, we've got it pretty well handled. We were able to knock out the backlog within just a few days. And I think we are just relying on state employees at this time to do the contact tracing. And Vermont is super lucky. I saw a headline this morning that we're, the envy of the nation. We don't have a huge amount of cases comparatively to other states. So we're still able to, at this point in time, unless there's, huge outbreaks that happen in coming months, we're able to do that contact tracing at the local level.
All right, that's good. And I know that Brattleboro just offered up some testing. What was it, last week at this point? We're recording this on May 19th.
Yeah, we did on May 14th, so last Thursday, we worked with the National Guard and with Rescue Inc., which is our local EMS agency, to do kind of a pop-up clinic testing site. And we were in 6 hours, we were able to test, or we collect specimens. So the testing doesn't happen at the site, but we collect specimens of over 350 people.
Oh, okay. All right.
Mhm.
And that went fairly. From what I understand, the actual from the point that you get in there, and they collect the sample, which doesn't look like a very comfortable process in and of itself.
Yeah.
And somebody described it as having their brain tickled.
Yeah, I've
So,
heard that too.
yeah. So, but it's really just a quick. You're literally in and out within 30 seconds.
Yep.
All
You're in
right.
and out. And those of us who have done we've helped with other districts regionally to do this, and we've got it down to a pretty good science at this point. I would say it maybe would have taken longer if you came to get tested a few weeks ago when we were still learning how to, kind of make everything flow well.
Yeah. Well, I keep saying that nobody pandemics well, and we're all trying to we're all trying to fix the car while it's moving here. So, I mean, as things get figured out, I'm sure that these things will just become like muscle memory. Uh,
Hmm.
can you explain why somebody would get tested? I mean, I've been fairly operating within my own bubble. I guess I don't show symptoms. Is there a reason for me to be tested?
At this point, I would say it's like we're pushing for anyone who wants to get tested to get tested. So say that you had um, somebody you wanted to visit who is at higher risk for perhaps dying from COVID-19 than you were, and you know that you don't have any symptoms, but we also know at this point that lots of folks who have tested positive have no symptoms. But say I wanted to go visit my grandparents who, if they contracted COVID, they could easily die.
Yeah.
And I didn't think that I had it, and I've been quarantining for 2 weeks, but I'm going to get tested to make sure that I can go visit them. I think that's an example of why some folks might be getting tested. I would also just remind people, though, that it's a point in time test, right? So you can get tested on May 14th at our site in Brattleboro, and your results can be negative, but you could go to the grocery store the next day and pick the virus up there. And I'm not trying to scare folks,
No.
but that's the reality of the situation. If you're not consistently getting tested, you're not necessarily not carrying the virus.
Right. So if I'm going to visit somebody, then that would be the impetus behind me getting
Mm-hmm.
tested. Um, so it's not like, and there's no cost for the tests. Am I understanding that correctly?
There's no cost. I can't speak for like how hospitals are doing their testing. At any of the state sites, the pop-up sites, there's no cost. You don't need a medical order, so you don't need your primary care provider to sign off saying that you need a test. You don't have to have any symptoms. You just have to pre-register.
All
That's
right.
pretty much it.
So, Laura, so you mentioned something that I want to circle back to. So the pop-up testing is of course free, and not knowing what the protocol is for, say, Brattleboro Memorial Hospital or one of the 24-hour emergency care
Mhm.
places. But those are other places that are offering testing if I want to walk through the door and get it.
Yeah, they are. And I should know, I can't speak for how testing happens at one of the 24-hour like clear choice clinics. I'm not sure what the criteria is there to get tested. And to my knowledge, I still think you can get tested at BMH. I think you still will need a physician's order to say that they think you should get tested. And so BMH aside, I don't know how it's going on there, but I've heard from other places around the country and around the state that a lot of physicians might not sign off on that order because you don't have any symptoms,
Okay.
or haven't been in contact with somebody who might have COVID, that
Okay.
kind of thing.
Now, do you see any more tests being administered in Windham County in the foreseeable future?
Yeah, so we're in the planning process right now of figuring out how to do a testing site once a week. So there's 12 district offices around the state, and the goal is that we will all be doing these pop-up clinics once a week. So ideally, you'd be able to go pretty much anywhere in Vermont and get tested, and we'll have the capacity to test, again, 300 folks a day. And I can't, the details are still getting worked out, so I can't even give you like an exact day that we're going to be doing it in Brattleboro every week. But there will be opportunities for folks to get tested, at least until pharmacies come on board with testing capabilities. So we're kind of just doing like a gap fill until other places have the capacity to do the testing.
So more or less treating it like your flu shot. You're able to go to your local pharmacist to get that.
Yep.
All right. Well, we've covered the criteria. We've covered everything else about getting tested. Let's talk about the things that we need to do to prevent contracting the coronavirus. And that is, and you and I have had some good laughs about this prior to this, but the proper way to wear a face mask. Let's discuss that for a second, because there is a proper and an improper way to do this.
There is, and I know we laughed about this earlier. I don't know if it's that the information isn't out there for folks yet, or enough of the information isn't there, but there is a proper way to wear a face mask, and you have to find a face mask that really fits you. So a lot of the time I see folks in grocery stores or in public settings wearing their masks, under their nose or even just around their neck, like under their chins. And I've even seen people on, hiking trails, and maybe this isn't the best example, but, they're not wearing their mask, and then when they see me coming towards them, they quickly put it on and then they take it back off. And so the proper way to really wear a mask is, one, to have a mask that fits you. A lot of the time I've seen, those paper surgical masks that clearly someone's been wearing for 4 or 5 days, so that if you're wearing a disposable mask, you really should be getting rid of it as quickly as possible. But also when you're wearing a mask, the point is that you might be asymptomatic, but you might be carrying the virus. So you want to keep your germs away from other people. So you don't want to be taking your mask on and off multiple times by touching the face covering. You should be only touching the strings that go behind your neck or your ears. And if you're taking it on and off, making sure that you're washing your hands or sanitizing them before you do it. It's really, and if you're wearing one that's not disposable, making sure that you wash it all of the time, because it will just become a huge carrier of germs, and not even just the virus, but any of the germs that you could spread to anyone.
So if you have a cloth mask, my wife and I do, we'll often, whenever we do laundry, we'll grab it, throw them in there.
Yeah, for sure.
So I want to go back to something. If I'm just all right, so I cycle a lot, and I wear one of those neck gaiters now, so I can just pull it up, because wearing a face mask while you're cycling is
terrible.
Yeah. So and I'll do that if I have to come in contact with somebody. I will pull it up.
Yeah.
Before I get there, I'm always forever walking around with a bottle of that stuff.
That's great.
And so constantly disinfecting, even though I haven't touched anything.
Yeah.
But you mentioned if you're on a hiking trail, somebody pulling that on and off when they see you. Explain the thinking behind that. Is it should they have it on the whole time, even though they might just be walking alone?
Yeah, sorry. So that was why I was talking and saying to myself, this is a bad example. But if you're walking alone and you're not touching anything, of course, taking your mask on and off is totally fine. I'm a runner, and I bike a lot in the woods, and I do not wear a face mask when I'm in the woods. I step out of people's way to give them 6 feet or more space. like you, I would hate to be breathing into a mask while I'm exercising. But I think a lot of people will say to themselves, oh, I'm safe because I'm wearing a mask, but I'm still touching it and pulling it up and down and touching my face, and maybe not like you, carrying hand sanitizer around. And they come out of their walking trailer, the woods, and they go to, I don't know, the country deli, and they buy something and they touch a keypad and then they put their mask back on. My point was more that if you're not sanitizing your hands all the time, putting a mask on and off and on your face is not going to help anything.
All right. Thank you for clarifying. I just wanted to make sure that I was,
Yeah.
when you said that, I just thought, oh my God, I've been doing it wrong. Oh no. And I've really been trying to pay attention. So let's talk about the new term for social distancing, which is physical distance, and how people are going to continue to be safe. And it's a lot of, pardon what will become a pun, rinse and repeat.
Yeah. Yeah, I think, and I can't say why, I'm pulling the language from our Dr. Levine, our health commissioner. I think social distancing, folks think about it, and myself included, as like, oh, socially, I think about being with people who I know and being with, being in a comfortable situation. And physical distancing, I think, just makes people more aware of like, oh, when I go into Hannaford or I go into whatever store, I need to stay physically away, like 6 feet or more away from somebody else.
Okay. All right. And of course, everybody's still washing their hands for the recommended 20 seconds.
I know, and that cracks me up too. As a kid, I just remember being told 90 seconds, like 90, you need to wash your hands for 90 seconds. And I think that, I mean, this is just humanity, our attention spans are so short. I'm hoping that there is still science behind 20 seconds instead of 90. But I was laughing back in March when we started pushing just 20 seconds. That's it. Just give us 20 seconds. Please wash your hands for 20 seconds. So I'm at least hoping that this lesson is something that folks take with them, even when we're not in the middle of a pandemic. You should always be washing your hands for 20 seconds. You should always be washing them when you get back from the grocery store. But we'll see.
Many jokes were told about how Americans had to be reminded to wash their hands when we first settled into this, and never in a million years did I think that my hands would get more alcohol than my mouth. But so, Laura, is there anything else that you feel we haven't covered that you want to get out there?
I don't think so. I think just the basic, like I said already, Vermont, as a Vermonter, we're very lucky. We are not living on top of each other like some folks are in other bigger cities and states. And our infection rate is really low. And if folks can just remember to, wash their hands for 20 seconds and wear a face mask. If you're going to wear one properly, because if you're not wearing it properly or sanitizing it properly, then you might be doing more harm than good. And yeah, staying away from people still, as long as the health commissioner and the governor is saying that that's the safe thing to do,
then we'll continue to do it. I mean, we can take. I took a nice picture the other day when I was walking my dog of just wide open spaces, and I just said, this is welcome to Vermont. We've been social distancing since 1791.
Yeah,
So,
it's true. It's true.
So it is a little bit easier. Laura, thank you for jumping on a call to action today. I appreciate your time and the good work that you're doing.
Yeah, thanks for having me.
All right, take care.